Good afternoon. I'm Nancy Day Acauer, pastor of St. Mark's United Methodist Church. And on behalf of Mayor Andrew Ginther and the Franklin County Commissioners, I welcome you to the Franklin County Opiate Action Plan community rollout. We are here today because we are in the midst of a public health crisis. This year, Franklin County has already experienced a 66% increase in opiate-related overdose deaths compared to the same period last year. Many of these deaths come from my community on the west side of Columbus, but they're happening everywhere, touching all neighbors, touching all neighborhoods and demographic groups. Opiate addiction is an equal opportunity afflictor. And if we continue on our current trajectory, over 500 people will die of an opiate-related overdose in our county in 2017. When we talk about the epidemic, we tend to refer to numbers. The number of naloxone administrations, the number of emergency department visits, the number of overdose deaths, the number of children left without parents. Those numbers are important for understanding the extent of the epidemic, but numbers make it easy to distance ourselves from the human lives that are lost or broken. Each number represents someone's child, parent, grandparent, or sibling. We do not know all their stories or the circumstances that brought them to the place where they became a statistic, but I grieve over every loss. It's easy to get caught up in the tragedy and feel overwhelmed, to believe that this is a problem that's so big that it's hopeless, but it's not. I know many people who have overcome opiate addiction, whose lives have been transformed. It was hard work, but they had programs and they had people that helped them. I think of Bobby, who is on a journey to recovery. 2 months ago, he was living on the lam and addicted to heroin. His life wasn't always like that, but he turned to heroin to cope with the death of his wife and child. And while at a free meal for the homeless, he heard a message of hope from Fred Reeser. And that night, he handed over his drugs, and he asked for help. Fred got him into detox and into recovery. And he's been clean now for 66 days. There is hope. There are people who care. We are here today because we care. We're committed to saving lives. And that's what the County Opiate Action Plan is about. Saving lives so people have the opportunity for a new drug-free life. Many of us here have been working together on several initiatives and a task force for quite some time now. Not because of media pressure or for personal recognition, but because we're passionate about saving lives. We have accomplished many important steps that are necessary for moving forward in addressing the opiate epidemic, but we still have a lot of collaborative work to do. The opiate epidemic involves many complex factors, and it needs a multifaceted response. Equally important, it's a community program, and it needs a community response. We're in this together. We cannot work in isolation or abandon our neighbors if we are to succeed at eradicating this epidemic. The theme of the Franklin County Opiate Action Plan's report is building the bridge to tomorrow. Bridges aren't built using only one tool. Bridges are built when several specialists and numerous skilled workers using a variety of tools work together over an extended period of time, following a carefully designed plan. The end result lifts people up and carries them to a new place. Franklin County needs a bridge that will lift people up from the hopelessness of addiction and carry them to a new place of hope. a place of hope where they can live a life of recovery. Together, we will build this bridge. It is now my honor and privilege to introduce the 53rd Mayor of Columbus, Mayor Andrew Ginther.
Good afternoon, and thank you all for joining us here today. Pastor, thank you for setting the stage and for all of your continued work on this issue. We are here today because of your investment, time, energy, and resources, and so many others throughout our community. I am grateful to have our great partner, President John O'Grady, and his colleagues on the County Commission, David Royer, CEO of Adam H., Council President Kline, who's been an incredible partner and advocate in putting this plan together and moving us forward as a community, our coroner, Dr. Ortiz, Dr. Roberts, and the great team at Columbus Public Health, the Franklin County Opiate Task Force, and obviously these two incredible faith leaders, one you've heard from and one will close us out, about the impact and the way forward for this community together. I know we have a lot of speakers today, but that is because of the breadth and the depth of the opioid epidemic in our community. The number of people dying from overdoses is escalating dramatically. And we know that the solution to this problem, to this crisis, cannot come from any one entity. In fact, we've come together in ways that we have in the past when this community has faced great challenges. Whether it's infant mortality and the Celebrate One initiative, and homelessness and the lack of affordable and supportive housing, came the Community Shelter Board, the Columbus Way, the way we tackle our biggest challenges together. The public sector, private, and nonprofit coming together. It must be addressed by the city, the county, everyone in this community, the healthcare community, faith community, by families and our outstanding first responders who see the faces of this crisis every day in our neighborhoods. I'm grateful for the collaborative efforts it took to put this plan together to save lives. Hundreds of partners, allies, addicts, family members, providers were all interviewed to help shape and drive the recommendations in this comprehensive evidence-based report, a plan for our community to take on this crisis. Some efforts are already underway. Last month, Adam H., along with Southeast Healthcare, the Division of Fire, started REACT, a pilot program that offers immediate substance use disorder treatment services to a person who experiences a life-threatening overdose. The REACT team provides support to paramedics, offers crisis intervention, including the use of Narcan if appropriate, and facilitates links to immediate addiction services. In addition, last week, our Columbus Public Health Department, along with the Division of Fire, trained 125 community members in CPR, the application of Narcan, and how to discuss drugs and addiction with family members and friends. Those are just some of the first steps. And today I close with a challenge to our state and federal leaders who have consistently told me, give us a plan. I know you might have initiatives and programs, but give us a community-wide, evidence-based plan to fight this crisis. Well, I would say to our federal and state leaders, here it is. And it's time for you to step up and provide the resources and partner with us as a community to solve and deal with this crisis. Our families, our employers, our neighbors are counting on us. And we have a plan that I am confident to help bring a brighter future to families. I have said it before and will say it again. I believe one of the greatest risks and threats to family stability in this community is this crisis. It's tearing families and neighborhoods apart. And I believe this plan provides a way forward and asks for our partners at the state and federal level to stop talking and start funding. And this is our plan for this community. It is now my honor to introduce our great partner in this effort, the Commission President, John O'Grady.
Pastor Nancy, thank you. Mayor Ginther, thank you. Good afternoon, everyone. Thanks for being here today. I don't know if anybody noticed, the mayor was talking about, our plan was talking about the legislature and the state house, and he was talking about the federal government, and the lights went on. The lights brightened. Did anybody notice that in here? Somebody down the street better get the light bulbs turned on. Thank you, Mayor. A few months ago, the mayor and I met with the community. We met with law enforcement. We met with public health leaders. Dr. Long, good afternoon, Dr. Long was in the room, along with Joe Mazzola from Franklin County. We met with others who we began working to address the ongoing opiate crisis in our community. We sought to collaborate with everyone. We wanted a community-wide plan to enhance the efforts to stem the growing tide of overdose deaths in this community. Adam H., under the leadership of David Royer, took the challenge to create a plan to mobilize and coordinate resources, and they've done a fantastic job of it with this opiate action plan that's being released today. Thank you, David. Thanks to your team at Adam H. Your agency works every day to improve the well-being of Franklin County residents, and you truly are doing work to save lives. And make no mistake, this plan is about saving lives. This plan brings together all of the excellent experience and the good ideas of our community and identifies concrete actions that we can begin to take and make today to help prevent addiction, expand treatment, and save lives. Now it's time to put this plan and its recommendations into action. And I want to thank the members of the steering committee, those of you that are here today, that are identified in this plan and that will carry out this work and carry it forward to make sure that the actions that we take are effective. We have a lot of work ahead of us, and it's going to take everybody pulling together in the same direction, pulling together to address this public health crisis. Fortunately, we aren't starting from the beginning by any means. The Franklin County Opiate Task Force, Heroin Overdose Prevention and Education, or the HOPE Task Force, and Adam H.'s multi-million-dollar investment in treatment and prevention are all already working hard on this crisis and have done excellent work so far. Our new opiate action plan will build on the work that they've already been doing, and they'll bring our community's efforts together. On behalf of my colleagues at Franklin County, Marilyn Brown and Kevin Boyce, I'm really proud to support the implementation of this plan, but most importantly, I'm proud of what this plan represents. Together, all of us will save lives. At this point, I'd like to introduce our new Columbus Public Health Director, Dr. Mashika Williams-Roberts.
Thank you, Commissioner O'Grady, and thanks to all who were involved in creating this very important plan. Opiate addiction makes the news across our country and right here in our community just about every day. But one fact that often gets lost is that opiate addiction is a chronic, relapsing brain disease. I want to emphasize that for a second. Addiction is a disease of the brain, not a disease of one's character. Our efforts in treating this must focus on that. The effects of the opiate epidemic or the opiate addiction crisis continue to take a toll in our community. Just yesterday, the Franklin County coroner announced that in the first 4 months of this year, we lost 173 individuals due to drug overdose. That's 173 mothers and fathers, brothers and sisters, sons and daughters that are no longer with us. That puts the county on pace to have a 66% increase in overdose deaths in 2017. The toll on the medical community is also staggering, as the need for treatment and recovery is greater than ever. The plan that is put forth that we're sharing today puts real, tangible programs in place to help. Columbus Public Health will lead the way in many of these efforts. We will help to expand school-based prevention because the most effective treatment for addiction is prevention. Together with our partners, we will provide 10 syringe disposal sites because addiction also leads to other chronic infectious diseases that can be lethal, like HIV/AIDS and hepatitis C, which are often transmitted by sharing needles. So we will also provide safe medication disposal strategies because we must address every aspect of the opiate crisis. This means we will provide drop boxes and biodegradable bags for disposing of medications that are no longer needed. And we will host drug take-back days because we know that some drug use starts with prescription drugs left over from legitimate and necessary medical procedures. These strategies give every member of the community a chance to safely dispose of medications to keep them from falling into the wrong hands. This plan reaches into every corner of the drug problem in our community, and I am very proud to be leading the efforts of Columbus Public Health in this fight. Now it is my pleasure to introduce the CEO of the Franklin County Alcohol, Drug, and Mental Health Board, David Royer.
Thank you, Dr. Roberts. Let me begin by thanking Mayor Ginther, the Board of County Commissioners, and change the arc of the narrative. I think it's interesting that we find ourselves in a building that has been transformed and serves as a magnet for the rejuvenation of this community, and we find ourselves in a room where the largest word painted on the wall is hope. We come together to take these steps to respond to an opiate epidemic. And working together, I'm convinced that we can move the narrative from how bad things are to how much better things are getting. I do want to recognize that while Adam was tasked with leading the development of the plan, this action plan is a reflection of a collaborated effort of our entire community. Many of you are in this room today. This collaboration is a cornerstone of how we operate and how we choose to live our lives here in Franklin County, the city of Columbus, and Central Ohio. I would like to believe that this opiate plan is just another example of that strong tradition and that core value. As part of the process of the plan, we sat down as a staff and talked to well over 100 individuals representing over 62 organizations within a 4-week period that somehow interface with the problem of the opiate crisis. And from those conversations, we recognized some emerging key areas, so we organized this report in 4 core sections: prevention and community education, healthcare and risk reduction, treatment and supports, first responders, and law enforcement. In each of these sections, these actions are identified through 2019, with many of the actions identified to be completed yet this year. There are a total of 61 actions included in this plan, and this is just the beginning of the work. Now, I get the opportunity to introduce someone who's brave enough to come here and talk about his personal story. David Siegel is a person in long-term recovery with 6 years clean and sober. He grew up in a suburban neighborhood here in the Franklin County area and battled addiction for over 10 years. It's my pleasure to introduce to you David Siegel.
Man, were to tell me 6 years ago that I'd be standing in front of you all today, I would have said you got the wrong ginger. But 12 years old, I started using drugs, and I was raised in a good home. Both parents were in the household. They taught me everything that I needed to know. I don't know what happened. I know I was bullied a lot in high school and in middle school and elementary school. And I wanted to find purpose, and I wanted to find meaning, and I wanted to feel connected with my peers. Boredom, being bullied, led me to think that if I was to fit in with the crowd, that would work. So we started off using marijuana at age 12. And again, this is in the suburbs. It turned into a weekend thing to an everyday situation for me. That wasn't enough. We got pleasure out of it, and most of my friends were doing it. As years would go on, I would realize that I would dabble into other different things. The sporting events afterwards, and what we would do as, my friends and I, we started experimenting more and more with different drugs. In high school, I was a varsity volleyball player and I injured my back. That's where things took a huge turn for the worst. Opiates entered my life and I found my first love. It completely destroyed everything that I had, every family thing that I went to. I hurt my parents, but I was a good kid. It completely had a toll over me. I had nowhere to go and I was broken. At 21 years old, I had a $200 a day habit from using opiates and heroin, and I was 120 pounds, and I'm 6'5", with nowhere to go, completely broken. After lying and stealing from my parents and manipulating everyone that I possibly could, I ran out of resources, and I decided that I needed to get myself into treatment. So on May 23rd, 2011, that's what happened. I didn't want to go, but I knew I had to change or else I was going to die. That changed my life. And at that moment, I knew then that I needed to make a difference. Because as soon as I got out of treatment, I buried 30 friends in the first 3 months to this disease of addiction. And I'm going to funeral after funeral, and I'm thinking to myself, what is going on? Good homes, good families, and we're just being overrun by this drug epidemic. Over 4 years ago, I decided I wanted to create the Loud Life Foundation. LOUD stands for Live Out Your Dreams. Life is living in freedom every day. I got so sick and tired of burying my friends that I wanted to do something. We also created a clothing brand to start a movement and to have people feel empowered, because our mission is to inspire and empower those affected by addiction. In the course of 2 years, I've also joined together with an amazing organization called Tyler's Light. Wayne Campbell has been a mentor and a dear friend to me, and we were out there with boots on the ground, working vigorously to talk to your kids, business members, and anyone that we can. In the course of 2 years, Loud Life has sustained and placed people, and 250 of these people, into long-term recovery. Loud Life has spoken to 75,000 students. My mission in life, our mission in life, is to help and give hope to these people and let them know that you're not alone. This epidemic needs to be taken care of, and it's hitting everywhere. But I will say this, that the reason why I'm standing here today and speaking my voice is for those that have no voice at all, the ones that I've buried, the ones that I've lost. Together we do recover. Thank you.
Thank you, David, for sharing that. I find it inspires me to work harder, but it humbles me to be with you and to hear your honest story of changing the lives of others. It's a powerful mission. Thank you. It's also my honor now to introduce somebody who I've just really begun to get to know in a much different context, and that's City Council President Zack Kline. Throughout the process of developing this plan, Council President Kline has provided us with great counsel, and I've been really quite struck and continuously struck by his personal passion and dedication towards addressing this issue, but also the issue of mental health and mental health care in Franklin County. We're very fortunate to have someone in Council President Kline's position that can be an advocate for all of behavioral health, but especially in the case of this problem, being a strong advocate on the opiate crisis. Would you please welcome Council President Zack Kline.
Thank you, David Royer and the Adam H. team, to Mayor Ginther, Commission President John O'Grady, the other commissioners, Dr. Ortiz, and the members of the Opiate Task Force, and frankly to all of you in this room who are on the front lines every day fighting drug addiction and opioid abuse in our community. As we all know, Franklin County is not immune to the drug addiction problems that are plaguing our nation and our state. The reliance of opioids often starts with the medical script that we just heard for pain pills. And as we now know, these pills can lead to an addiction and then an escalation to other cheaper means of getting high that then stresses our health systems and our public safety personnel. The proliferation of drugs and subsequent addiction are eroding safety in neighborhoods and presents challenges to our economy, not to mention the devastating impact it has on our families and our friends. Addiction is a mental health disease. It does not discriminate. Regardless of race, gender, or wealth, no one is immune to this threat. And as a daughter, or as a father of a 2-year-old son and a 4-year-old daughter, a day doesn't go by that I don't think about the threat that they face as they get older. I must acknowledge that while we speak of the opioid addiction today, the drug epidemic story is not new to our nation's narrative, and I think it's really important that we got to recognize this. Many communities, like rural and minority communities, have faced addiction and its problem for decades, and it's largely been ignored. And now, because addiction and its devastating effects are part of the mainstream conversation, we're finally openly talking about it and taking action. So with history as our guide, we are at this important moment to define how we move forward as a community. And moving forward means building a model that addresses mental health and drug addiction in a comprehensive way. It's got to be comprehensive and forward-thinking because it was crack cocaine in the 80s, it's heroin today. What's the drug going to be tomorrow? So while this action plan is about opiates and opioids, we cannot shortchange ourselves, our families, our neighborhoods, our economy, our safety, our children's future with limited foresight. We must build a model that includes education and treatment that strikes at the heart of mental health and drug addiction. In order to be effective, we have to identify this as a community priority and not assume that our hospitals will absorb all of the treatment costs. If you take a look around, there are specialized clinics for hips and joints and cancer treatment, and all that's very important. But there simply isn't the same focus and expenditure on treating mental health and drug addiction. In fact, there's a shortage. Not enough providers, not enough beds. And if Medicaid expansion is rolled back, the stress in the system will be even greater. If you're fighting to eradicate drug addiction, then you must fight to keep Medicaid expansion. So let's use this opioid epidemic as the impetus to start treating drug addiction and mental health. Let's capitalize on this moment in time to build a system where we can have robust education and discussion about the highly addictive nature of these drugs. Let's use the moment to stack hands the Columbus way, like we always do, to build a system that treats mental health problems and drug addictions now and in the future, regardless of what the drug of the day is. And let's continue to support the great men and women of law enforcement who work to end the supply. This isn't going to be easy, it's not going to be cheap, but I'm confident that we can act today and look back 10 years and know that we did our part to treat mental health and drug addiction. Look back and we know we gave hope to the addicted. that we did our part to educate children about the real-world impact of drug addiction and its highly addictive qualities, and that we did our part to give families the opportunities they deserve to succeed. So now it's my honor to introduce Pastor Jason Ridley with the Hilltop Community Worship Center. Thank you.
The great African-American inventor George Washington Carver once said, "Where there is no vision, there is no hope." Today, our mayor, along with our city council president and county commissioner, as well as others, have laid the foundation for a plan that will attack head-on the opiate addiction crisis here in the city of Columbus. I thank our city officials for recognizing opiate addiction for what it is, which is a disease. And as a faith leader, I support the steps that are being taken today because they fall in line with the Christian principles and values that I hold so dearly, where Jesus Christ reminds us that it is our duty to help the sick. So I thank all of our city officials for having the fortitude to lay out a vision which I believe in time will begin to help turn the tide of the opiate crisis in our city. I want everyone to remember we must keep in mind, however, that there is a long road ahead of us. Just as recent as April, many have heard the statistic that has been mentioned, that there's been a 66% spike. We're on target for in opiate deaths this year compared to where we were on last year. On the Hilltop where I pastor, every day I see firsthand the impact that addiction has on the community and on the family. I think of a young man by the name of Eddie, who, it was a Thursday morning and we were studying, having Bible study in my office, and I could remember the smile on his face. He was so excited as he was sharing with me about how he wanted to marry his fiancée soon. But later that same day, she was found in an alley having overdosed on heroin. So we have a long road ahead of us. But today we are laying out the first steps, which acknowledges that the fact that our city leaders recognize this is a problem. There is a vision for the future. And with that vision comes a plan that is being implemented, and a change is coming, and we have hope for a better day. You see, hope, as Bishop Desmond Tutu declares, is being able to see that there is light despite all of the darkness. Things may look and seem dark right now, but a change is coming, where mothers and fathers will be reunited with their children, where a change is coming where husband and wives will be reunited. A change is coming where brothers and sisters will be reunited because the strongholds of addiction will be broken in citizens' lives. A change that will impact the number of homeless who wander our streets with no place to go, because they will be able to become functioning citizens in society again. A change that will lessen the number of girls and young women who get caught up in prostitution and sex trafficking as a result of being forced into being hooked on drugs. A change that will boost the morale of our communities as they witness the reduction in violence and drug activity in their neighborhoods, all because this new plan will lead us to a bigger, better, and brighter future for the city of Columbus as we come together as one team. How many teams? One. As we come together as one team to attack this crisis head on. And my hope is that the example that we set here in this city of Columbus will be an example for other cities in the state of Ohio and other states across this nation as this opiate addiction crisis is attacked. And we're taking it on here in Columbus. So let's salute all of our city officials who are on this platform, who are taking this initiative today.